I want to say good morning to Renee, my friend. Good morning, Renee Friend.
Good morning, Shane. Thank you for having me.
I love your last name. So, Renee, is it like a tricky a pronunciation to it, or is it just Friend?
It's just Friend.
I love it. Thanks for joining us this morning, Renee. Renee is the Behavioral Health Nurse Manager, RN, BC, from Maui Health. Renee, April is National Workplace Violence Prevention Awareness Month.
Yes.
What is workplace violence, and why is it such a big issue in hospitals?
Yeah, so workplace violence includes all forms of abuse. That could be physical violence, verbal abuse, harassment, intimidation, and really any other disruptive behaviors. And what people typically don't know is that, unfortunately, healthcare workers face violence at work 5 times more than other workplaces. And when I tell people I know about this, they're usually surprised and ask, wait, why would that be? But if you think about it, when patients and their family members come to the hospital where it's already a high-stress environment, and they're dealing with not feeling well, or they're in pain, and on top of that, they're typically worried, scared, or maybe even frustrated, sometimes these emotions can turn into aggression towards the healthcare workers. And the impacts of workplace violence are serious and can affect the quality of work that we provide. You know, with the added stress, anxiety, and physical and emotional injury, that can pull our focus from our work, and that's not what we want. As healthcare workers, we're trained and worked really hard to recognize and de-escalate these situations, but preventing workplace violence truly requires everyone's help. So we ask the community to help us keep our healthcare workers safe.
You know, Renee, for the public, for us who rely on our healthcare workers, the service at our hospital and clinics, what can we do, the public, to help prevent workplace violence in our local hospitals and clinics?
Yeah. Well, what it's really about is collaboration and working together. And the best way we can do that is through communication, kindness, and respect. We encourage everyone to communicate your needs clearly with your care team. And at the same time, understand that sometimes needs can't be met exactly or immediately. But ask questions, share your concerns, and work together with your team to find solutions. Another important part of the communication of this is that if you feel disrespected by a healthcare worker, please speak up. This helps raise awareness and allow staff to reflect and adjust their approach or connect you with someone who can better help. This month, Maui Health's Keep It Kind campaign encourages this culture of respect and kindness.
Tell us a little bit about that, Renee. What is the Keep It Kind campaign, and how can we all get involved?
Yeah, our Keep It Kind, More Than a Uniform campaign raises awareness on the growing issue of workplace violence in healthcare. It provides opportunities for the public to support, advocate for change, and show appreciation for our healthcare workers. And a reminder that we are more than just the uniform we wear. We're part of this community. We're your neighbors, members of your church choir, or maybe even your kid's soccer coach. So please show your support by taking the Keep It Kind pledge at www.mauihealth.org/pledge. There, you can also watch stories of who we are behind the uniform. Show your support at www.mauihealth.org/pledge and take the pledge and get to know your Maui healthcare workers.
Awesome. Renee, thank you for being a friend this morning and bringing us this crucial information, because I was not aware of this type of workplace violence and in the hospitals. I never thought that far, but thank you for bringing that awareness to us this morning. And Renee, we'll talk again, all right?
Awesome. Thank you.
Have a good day. Aloha.
You too.